Hi everyone, my name's Rob. I'm a Cardiac Rehab Supervisor here at Toronto Rehab. Now, a little birdie told me just the other day that you guys were coming towards the end of your program, which is fantastic. I'll bet it seems like just yesterday that you guys were here for the first time and really wondering what you had gotten yourself into. What's this rehab thing all about? Well, look at you now. You're a few weeks away from becoming official graduates of the program. You've been here week after week, catching all these wonderful educational sessions, walking mile after mile, lifting all these weights, meeting new people, helping each other along the way. Well, now's probably a good time to sit back and reflect about that time, thank yourself for all that hard work that you guys have put in, and congratulate yourselves. Congratulations to all of you. Now, some of you might be starting to think, what comes next? Where am I going to go to get my exercise in? Do I need to keep filling out those diaries? What if I have more questions? What are all these other patients going to be doing? Well, don't worry about any of that, because our plan over the next couple of weeks is to come up with some good answers for each one of those questions. Over the next few weeks, we're going to review some of the materials that we covered earlier on in the program. First, remember the lifestyle changes that contribute to a heart-healthy lifestyle. They include exercising on most days of the week, staying active, and not just physically, but also mentally and socially, and managing your risk factors, such as cholesterol, blood sugar levels, blood pressure, waist measurements. And of course, we also want to make sure that we have healthy diets and that we reduce or totally eliminate any smoking. Secondly, remember to keep working on your fitness by exercising regularly. When you're out there doing your walk, think FITS. F is for frequency. You should be aiming to walk most days of the week. I is for intensity. Make sure you're walking at a pace that gives you a safe but effective workout. Keep checking your heart rate to make sure it's in the right zone. Make sure you can carry on a conversation comfortably while walking, and your walk should always be comfortable and pain-free. T is for time. When we work out, we should be aiming to get in 30 to 60 minutes of exercise. T is also for type. Walking is a great form of exercise, but it's not the only one. Consider adding some biking or other types of activity to your routine to keep things interesting and fresh. Also, don't forget your weight training. It's good for your heart, your joints, and your bones in so many ways. It's certainly an important part of a heart-healthy lifestyle. Third, plan on how you might bounce back from any problems you might face. Maybe you've gotten sick, your conditions changed, maybe you're less motivated to exercise, or sometimes other things just get in the way. Maybe family, work responsibilities, or you go on vacation. We all know life happens. The important thing is not to focus on the problem, but rather figure out how you're going to get back on track. Try this. Number 1, think about what the problem is or what the setback is. Number 2, brainstorm a way to get back on track. Number 3, give it a try. Number 4, check in with yourself. Did it work? Number 5, if it didn't, could we try something else? Number 6, if you're feeling stuck, ask for help from a family, a friend, or give us a call. That's right, us. Even though in a few short weeks you're going to become alumni of the Rehab program, our relationship does not need to end. After years of hearing from our graduates that they wanted to keep in touch with us, with the help of Scotiabank, we created the Heart Health for Life graduate program. We designed this program for a number of reasons. To give you the tools to manage your health on your own, to connect you with great programs and resources and people who have had the same journey, and also to create opportunities for rehab champions to spread the word about the benefits of rehab, share their experiences, and help others through their own rehab journey. So, how are we going to do this? Well, number 1, to give you the tools to manage your health on your own. Over the past 6 months, your workbook has helped support you in your rehab journey. If you flip to the last section, you'll find a set of tools to help you stay on track. Things like exercise and food diaries, healthy tips, action planning worksheets, and lots more. You can also check out the resources in your grad package. Swing by the graduate bulletin board, visit our website, or subscribe to Momentum, our email newsletter that features grad stories, health tips, upcoming events, program updates, and links to other really useful health information. Number 2, to connect you with great programs and resources. By now, we all know the importance of tracking your exercise and progressing it safely. Why not take advantage of our free pulse check service? Come back every year for a regular stress test. One of our friendly staff will follow up with you to tell you how you're doing and make sure your exercise prescription is on target. If you like exercising here, you still can. Staying on Track is a program designed specifically for our grads. Here, we'll let you come to the center on a regular basis to exercise in comfortable surroundings with the knowledge that there's always a staff member here if there are ever any problems. If you want to exercise in your own community, great. There are lots of facilities and programs in the Greater Toronto Area that are safe and suitable for people with heart conditions or other risk factors. Just look for the HeartWise exercise symbol and find a facility near you. Beyond exercise, most of you have probably learned a fair bit about your health since you started with us. This kind of education can go a long way in maintaining your health and well-being. So we want to make sure our grads and their families and their friends can continue learning about how best to take care of their health. Join us every month for the Take C.H.A.R.G.E Alumni Education Series. We invite an expert to come talk to you and your families about the latest and greatest in health. Things like stress, diet, medication, new surgical advances. It's all in there. To keep things fun, we throw in a couple of social events to get you exercising and enjoying a great meal with your fellow grads. Number 3, to connect you with others who have shared in the rehab journey. Once upon a time, a group of grads wanted to stick together after graduating from the program. They wanted to keep walking together, talking together, and helping each other stay motivated to lead heart-healthy lifestyle. And then it happened again, and again, and yet again. Now our program is helping grads join peer support groups, create their own groups, and organize activities like our monthly peer support yoga program. Sometimes all you need is a friend to keep going. Number 4, Heart Health for Life Champions is our best example of what this program is truly all about. Our champions are grads themselves who come back and give their time to volunteer or advocate for lifelong health after rehab. From walking with other patients to helping out in the office, sharing their stories in class, to lending a hand at our fundraising walk. These champions are living examples of how Heart Health for Life is truly a program that is for grads, by grads. So, what will you do after graduation? I think there's a little something for everyone. Just ask.